Welcome, everybody. This is a health and wellness conversation series that I host regularly, about once a month and sometimes more, depending on the speakers and their timing. This is a volunteer activity, mainly for educational purposes. So we make no claims to diagnose, treat, cure, or prevent. Always refer back to your own healthcare provider. But we have a doctor here. So my name is Dr. Caroline Hong. My background, for some of you who don't know me, my doctor title is actually in dentistry. I graduated in 1983, which is a long time ago. So I practiced 15 years as a clinician dentist, and then I went on to become the first woman CEO of the largest dental association in Australia. After that, I moved to the medical sector and became a CEO of a medical imaging organization called the Australasian Society for Ultrasound Medicine for 10 years, 2 terms, for Australia and New Zealand, and part of an affiliated federation worldwide of 55,000 members of all disciplines. Then I burned out and I took on a part-time role as a CEO of a small and medium enterprise association. So in a snapshot, I have 40 years experience in healthcare in diverse sectors as a clinician in multidisciplinary environments, hospital, community health, private clinics, and in the healthcare public sector as well. Today, I have great pleasure in introducing Dr. Avi Charlton. And Dr. Avi, isn't she wonderful? She's color coordinated too. Yeah, Dr. Avi Charlton is a low-carb doctor, low carbohydrate doctor, and keto doctor. She supports nutrition using real food approach. There are not many doctors nowadays that actually have that approach. So I am so blessed to have met Avi, at least online. We haven't met in person yet. Dr. Avi graduated in medical school in Melbourne University in the year 2000. She trained at Box Hill Hospital as a junior doctor and has been a GP since 2003. Originally, she was born in Hong Kong. I was born in Malaysia, by the way, and she speaks fluent Cantonese. I speak broken Cantonese. She has been a doctor for over 20 years, 15 of those practicing in the Wantima Mall Clinic. She has a special interest in obstetrics, women's health, pediatrics, and recently in nutrition and metabolic health. Both topics I am so passionate about. So this will be like a Q&A. I'm going to ask Dr. Avi, who's going to answer some questions. So I'll lead on to asking Dr. Avi to please tell us a bit more about how you've become a GP and why and how you became a lifestyle GP instead of the everyday bulk billing fast 15-minute GP.
Yeah, thank you. Thanks, Caroline, for inviting me to come and talk. I've had an amazing journey and I'm very happy to share about my journey. What happened was I've been a GP for about 20 years now. About the last 6 or 7 years, I have had a change in my career, mainly because of a personal journey. What happened was I had my babies grew up a bit, and then I wanted to get fit and I joined the gym just like anybody would. And just for fun, I joined the 8-week body transformation challenge. And the gym PT gave me a diet, gave me a program to exercise. And I was so excited that I won the challenge. I won the 8-week body transformation challenge at the gym and lost about 4 kilos of body weight and 4% of body fat. And I was so happy. And what he told me to do is he had a spreadsheet and told me how much protein I had to eat, how much carbs I had to eat, and how much fat. So that's basically a low carb diet. And that the low carb diet utilizes either ketosis or just low carb. And I looked into the science and then I studied a bit more, did lots of nutritional training. And I was amazed that this is not taught in medical school. And I've been giving medications, prescribing blood pressure tablets. And, I started telling my patients who wants to lose weight or who have diabetes to try the low carb. and that I've had amazing results. A lot of them lose weight and then they feel better, less bloated. They corrected their IBS, irritable bowel symptoms, and the diabetes got much better. So I learned more and went to more talks, and I started my own clinic about 2 years ago and branded it Melbourne Low Carb Clinic. And lots of people come in to see me in my low carb clinic, and I've been so amazed that helping people lose weight and gain health. This is all through lifestyle. There is a place for medication, but I usually like to talk about a real food approach in terms of lots of whole foods, protein, healthy fats, and a little bit of carbohydrates. And depends on your metabolic health. Some people can have a little bit more, some people should have not as much. And a tailored approach, individualized approach. And I've had amazing results with my patients, losing weight and improving or even reversing diabetes.
Wow, that's fantastic. So tell me about diabetes type 2, which is the topic of conversation today. Dr. Avi, tell us, how big is the problem here in Australia? I know it's a massive worldwide. In Australia, it is increasingly a big problem. How do you generally, as a GP, lifestyle GP, make a diagnosis and how you help your patients? And your approach to nutrition and low carb can, I think, help a lot of people from managing their diabetes type 2, even to the point of healing and reversal. I know it's not all health professionals believe in the words healing and reversal. And generally, and I'm generalizing, of course, they prefer that you take the medication and be on it forever. Your approach is so refreshing. So tell us a bit more about that, Dr. Avi.
Yeah, absolutely. Type 2 diabetes is so common. I can't tell you the percentage, but I want to talk about the condition before you get to diabetes. It's called metabolic syndrome, which the characteristics is increased waist circumference, high blood pressure, high blood glucose, high triglyceride, and low HDL. You only need 3 out of 5 of this. So especially those with a big belly is most likely got metabolic syndrome. Metabolic syndrome is so common that it's up to 80% of the population can have poor metabolic health, even metabolic syndrome. So it's so common. And us as Asians might not be showing much on the outside that we have fat on the outside. So the Asian population is even more obscure. We don't really have to be fat to be having metabolic syndrome and diabetes. So to define diabetes, the HbA1c is the blood test that shows an average number of blood glucose over a 3-month period. So diabetes means HbA1c over 6.5, but we now know that if your HbA1c is over 5.7, you're actually pre-diabetes, you're getting close to diabetes, and it would be really good to get some lifestyle changes and prevent you from diabetes, because once you become diabetic, you have much higher chance of getting complications. Once you're diabetic, once your HbA1c is over 6.4, your risk of having heart attacks, going blind, blocking arteries in the feet, kidneys are much, much higher. Even if you're pre-diabetic, your risk is increased compared to the normal population. So I'm so passionate in warning patients that before you become a diabetic, there are things you can do. And even if you become a diabetic, if you eat real food, do lifestyle changes, reduce carbohydrates, then we can reverse the diabetes and reduce the risk of complications.
Wow, that's amazing. So you obviously run a very busy clinic, and I know you were even in a different class just before this session. Um, are, are you able to give us some real life examples of how you've helped people in the management, reversal, healing, and recovery?
Yeah, absolutely. The most motivated patients is the ones that I've just told them. The newly diagnosed diabetics are very motivated. quite often their doctor hasn't told them that they've had HbA1c 6, 5.7, 6, not quite 6.5. And they've been overweight, they've been trying, and nobody's pointed them in the right direction. So there's a couple of patients I can think in mind that I've told them, look, you're diabetic now. Your HbA1c is 6.6, 6.7, and they're quite overweight, big belly. And they want to lose weight, they want to not have the complications. I prescribed them the low-carb diet, and I told them, look, carbohydrates are all glucose molecules linked together. So if you eat the carbs, it's just like eating glucose, because that is the science of carbohydrates, is glucose molecules linked together. Your body can only hold 1 teaspoon of glucose at a time, which is 4 grams. If you eat more than 4 grams of glucose at a time, excess glucose is stored as fat, because the insulin that you made has stored it away. Yeah, so the body can only hold 1 teaspoon of glucose at a time. And if you have more than 1 teaspoon, excess glucose gets stored as fat by this hormone called insulin. 1 teaspoon, 4 grams of carbohydrates is 1 teaspoon of sugar. And that's all your blood can hold. And more than that, insulin will come in and put it away into the cells and store it for rainy days. If you're a hunter-gatherer, those fat will be used when you have not enough food. But in the modern lifestyle, there's excess food everywhere, and then another few more teaspoons of carbohydrates, glucose will come in the next meal. Sometimes we eat too frequent, every 2 hours, we have a snack. So that can be a problem when we keep raising our insulin and we get insulin resistance, which is eventually becomes type 2 diabetes.
Wow, you explain it so simply in terms of 1 teaspoon of sugar. That's I've not
Yeah,
heard
so
or medical
yeah,
educators speak in those terms. That's fantastic. So what is
yeah,
a typical low carb diet on a typical day? Because you're a working mother as well as a
yeah. That's right. I'm extremely busy. And cooking, there's no cooking time at all. And my cooking is getting easier and easier and simpler. But I try to still stay low carb myself. What I usually tell people to do is try to have protein-rich food, which is where the nutrients are. So protein is meat, eggs, chicken, fish, lamb, pork, real food, and above ground veggies. So they can have mushroom, tomatoes, broccoli, cauliflower, any of the veggies that is not very starchy. Try to have 3 meals a day, breakfast, lunch, and dinner. And as you go along the journey, sometimes you just stop being hungry and you can actually go to 2 meals a day and even sometimes 1 meal a day. So start with 3 meals, protein and veggies. So sometimes I have a few eggs if I'm going to have breakfast. And then lunchtime, I have a leftover, which is usually meat and veggies from the dinner the night before. So yesterday I had a bit of steak and I didn't have veggies, so it was just steak and I had some mushroom. And dinner is meat and veggies. So when I say meat, it incorporates chicken and fish and lamb and pork. So any of those animal food, that's what I mean by meat. Yeah, so I keep it very simple. I cook very easy meals. Sometimes I grill some chicken wings, which only takes half an hour. I'll put some lamb cutlets into the griller. That takes about half an hour. And steak takes 20 minutes. And I steam some veggies, which takes 20 minutes as well. What did we have tonight? Oh, we had bolognese. My kids have spaghetti, and I have an egg wrap with the bolognese because I don't want to have spaghetti. So my kids are more metabolically healthy, so I'm quite happy for them to eat a little bit of carbs, and I try to reduce it as much as I can. But I think they're okay.
That's fantastic. Yeah, I wish I knew all these tricks when I was a busy clinician and a mom as well. Thank you so much. Well, just now, Thank you, Dr. Avi. Stay on. I'm going to share with the audience, and I'm going to share screen if you just bear with me. So what I'm going to do now to the audience who have joined us here, I want to share with you a bit about my story and diabetes 2, type 2 in my family. And I might be talking about some things that I feel a bit vulnerable to talking to you tonight because I've not shared everything publicly before. So bear with me. So my story with diabetes type 2, it is a family history, strong family history. My grandparents have diabetes. My grandpa passed away in his 40s. My grandma actually, remembering as a young child, I remember her changing her diet very drastically and did a lot of walking, and she lived 20 years past my grandfather's after my grandfather passed away. Both my parents, my dad wasn't really healthy and passed away in his 60s. My mom had diabetes type 2 in the later 5 years of her life, and I saw her suffered, although I'm in Australia and she's in Malaysia, but the communication between the two countries and family members, it was quite sad to see the deterioration. I have members in my family, relatives, and also a sister-in-law who passed away due to diabetes complication in her quite young age from just a wound in her leg and got infected, and she passed away. And there are several members in my family, they don't want to be named, who are on metformin or are already being diagnosed to be on a diet control. During my pregnancy, I actually, with my second child, I was diagnosed with gestational diabetes. So Dr. Avi will know that gestational diabetes, diabetes type 1, diabetes type 2, they are the three categories of diabetes named in all the studies in Australia. And Australia spends a total cost and burden to healthcare system, direct and indirect costs, is about $15 billion per year. I also suffer from burnout, and I also have a recovery story, which will bear with me and I'll share with you later. So very briefly, my self-care, diet, exercise, stress, sleep, relationships, and ego. Did I look after myself very well? I thought I did look after myself. Having been in the healthcare industry, being a clinician, having practiced preventative dentistry, and having even written policies for the healthcare system, and being surrounded by medical practitioners. And now I'm told that most medical practitioners are not healthy themselves. Yeah. And so my self-care, which I thought was good, wasn't really contributing to my overall well-being in many areas. So my diet, I am ashamed to confess that when I was working as a CEO, my career was blossoming and really escalating, skyrocketing, and I was enjoying it on an adrenaline rush at the same time, but my diet suffered. So as I was talking about my family history, I didn't look after myself very well. My diet I thought was good, but wasn't really good. Now that I learn more about nutrition and how to look after myself and making sure that not only must I have the carbohydrate, not only must I have vegetables and protein, I had too much carbohydrate and I was not eating and digesting my food or even chewing my food. I was having quite a lot of processed food. I was having a lot of food that has additives in them. My exercise was quite limited because of my busy lifestyle, and the little exercise that I did wasn't really enjoyable either, and in fact contributed to my stress as well because I had to travel distance to actually get to the gym or to the exercise class. My stress level was extremely high, but I probably most of the time ignored that. My sleep was very bad. I survived on mostly 4 hours sleep. I worked 80 to 100 hours per week, which was the norm. And I was like a martyr, thinking that, that I was invincible, but I suffered later on. My relationships, my personal relationships did not improve. And as a result, I did go through a separation and a divorce. And now I'm happily married, 4 years married, and thanking God every day for a second chance in my life and in my marriage. My ego, I always thought that I knew everything, but I don't. I thought I knew everything just because I have 2 lines after my name. I have studied so much. I have so many degrees and so many letters after my name, but I actually don't know what I didn't know. So fast forward, this is just my personal story. So my personal support in my wellness journey actually accelerated. This only accelerated after I've taken a keen interest in looking after my health. And that was during the pandemic when I started reassessing my life going forward, reassessing what I want to do with my career going forward. And that was the time that I carefully look at my dietary supplements. I was already using dietary supplements for many years, but I was just using what was sold in the pharmacy or the chemist and just taking whatever the names say, like executive stress or sleep, calm, whatever, prebiotics, probiotics, not really knowing, thinking that I knew it all, and really thinking that the more I took, that would then fill in the gaps of the deficiencies in my life, in my diet as well. But I came across dietary supplements in 2023 last year, which has absorption rates of 3 times to 9.5 times higher bioavailability to our body cells than the pure molecule controls. That to me is a game changer. So therefore, I paid more attention because I've discovered that the bottles and bottles of supplements that I have in my drawer actually did not have absorption technologies in them, which therefore contributed and explained why I was getting unwell. I had extreme gut health problem for over 10 years, and I had all sorts of investigation and treatment and to and fro, and I did not improve. I might get better a little bit and then suffer again. And then these supplements also have epigenetic study, which contribute to energy, cognition, antioxidant, blood glucose and insulin levels, and inflammation. And therefore, because of the proven study that these supplements can actually can upregulate the good genes and downregulate bad genes to have positive epigenetics, I became more interested in these supplements, and also gave me peace of mind that they're all physician PDR listed, the prescriber's digital reference in the US, which is like the Bible for doctors. So the supplements that I use, very briefly, are different from everything else because of the exploration, the curation, and the absorption, and the fact that they are PDR listed, and also supported by third-party clinical studies, the absorption study, the epigenetic study, and the superoxide study, which helps to reduce inflammation or manage and balance the inflammation in the body. So this is just a nice picture of what I use. From left to right, you got the vitality, which gives me which is like a nourisher. I won't go into details of ingredients. You can ask me after the event. Revive, which is a restorer, which is for balancing your inflammation. You got immune, which is a protector. It keeps you your immune system strong and also helps you the gut health. The vitality also heal my gut health. The purify helps to detoxify. Eternal gives me the antioxidant and so anti-aging. The collagen is the collagen that helps me with my skin health as well as the supporting structures in my body. Then only last week, our company also released the world's first neurocosmetic. So it's a super skin serum, but it also has benefits in the way it sends signals to your brain to give you endorphins and serotonin, dopamine, and therefore keep you in a happy mood. You might wonder, why am I telling you all this? I'll continue my story. Okay, I've explained briefly my family history, my grandparents, my parents, my pregnancy, burnout. And this is how I slowly recovered and slowly healed. It's still being maintained, and I'm looking after myself as well as possible, and I'm monitoring myself. I've taken back control, there's lots of things that we can take back control and work with your health service provider. Somebody like Dr. Avi is a perfect example of a GP whose lifestyle, with the lifestyle and nutrition approach. So you feel a sense of control and you'll be more motivated when you are not just being told, take this medication, take that medication, and that's it, and not being given the steps or how to claim back a life that you crave for. So my self-care journey at a personal level, I decided to stay informed. So when I say I stay informed, I actually listen to podcasts, health podcasts from many, many different medical specialists. I also subscribe to the Harvard Medical Library, and I read a lot of the scientific literature, and I make my own judgment. I stay positive. I make sure I take care of myself first, because by taking care of myself is the first step to self being the ultimate carer, the best thing I can do for myself and for my family. And for me, it's a lifelong learning as well. My diet, I have changed my diet. I pay more attention to my diet. I look at food labels more carefully. I go on a low carb diet, just like Dr. Avi described. I don't have a lot of carbohydrates. I don't measure them, so I actually make it simple and also manageable and enjoyable. I have a lot of colors. I eat a lot of vegetables. I have protein, high protein in my diet. Low sugar, definitely low sugar. So it's really hard when at birthdays and at events, when at morning tea or afternoon tea, I can't help but say to the event organizer not to serve these muffins and cakes and scones and all that, because I am on a low sugar diet, and I like the colorful array of vegetables and fruits and in all my food. And also I'm conscious about fiber as well. So my diet is in moderation, but I'm very knowledgeable now on diet and nutrition, and I add supplements. All the supplements I use are non-synthetic. They're all whole food. They're all clinically tested, they're all third-party tested, they all have high absorption technology. So what is deficient in my daily diet, I have peace of mind when I add the nutrition supplements to my daily routine. It just gives me peace of mind. And I'm living proof, because after more than a year use, about 18 months now, I feel my healthiest self. Exercise, I integrate exercise into my daily life. I try and aim for 10,000 steps. I wear a tracker, but I don't reach that every day. But I don't bash myself if I don't. I just aim high for 10,000 steps. So it could be walking, going to the gym, dance, movement, and believe it or not, housework. If I don't do a lot of movement, I just take out a vacuum cleaner and move around with my vacuum cleaner and do housework. And also stress management, paying more attention to self-love, spending me time, and reflection, meditation, and writing a gratitude journal is something I do every day. My sleep routine can be improved. It has improved dramatically, because I do wear a sleep tracker and also mindful of the sleep hygiene, but my husband says that I still have a bad routine there. Relationships, I make sure that I have a supportive family and friends. I forgive the people who have hurt me. I have been hurt before, so I learn to forgive, and that's part of my healing, and also being close to your own personal healthcare provider. Ego, I have to humble myself, learn. Lifelong learning is the key. We don't know what we don't know. We have to keep an open mindset. Community is so important. Since the pandemic, there's never a better time to actually realize and be aware that a community, and be surrounded by like-minded global community, whether it's local or global, be surrounded by people who are supportive and understanding of your life journey and your health journey. Service to others, volunteer. I find that through the nutrition supplement company, I've been able to step up and serve. And I look back at why I always feel happy after I provide a service of some kind to a person, one-on-one, or to a group. I believe that my calling is to serve others and to help inspire others to be their best self, or to have a better life for themselves or for their family. Even if it's one person or a group of people or masses, that alone is enough for me to be able to be making a difference every day. Spirituality, it's only since I met my husband. We've been together for 8 years. We've been married 4 years. He has brought me closer to God. I was baptized a Christian, but I was still quite lost in the and empty spiritually. I have now paid more attention to prayer, having faith, and also gratitude every day to God, and loving myself more, living a life more, living life more fully, being more, doing more of the things I love to do, and being able to give more of myself. So I think that is a demonstration of my recovery, my diabetes type 2. I've not been taking medication since my diagnosis in 2007. Was the diabetes type 2 diagnosis when I was burnout, stressed. I was a CEO then, and I was a martyr on 4 hours sleep, working 80 to 100 hours. And no wonder I was diagnosed, which was a shock to my system. It was like, wow. And I remember the doctor telling me to go and see a diabetes educator at the time. And he told me that in 10 years' time, all these things, bad things will happen to your eyes, your organs, your kidney, your legs, your skin, everything. But all those things have not happened. So I've been on a yo-yo journey. I have not been taking medication, and my HbA1c, as Dr. Avi said, so the HbA1c is a good marker. HbA1c has been fluctuating, but it is within manageable control, and I am sticking to my routine that I've listed here, and also being helped, I believe personally, by my nutrition supplements, the 6 nutrition supplements that I take every day. So how to connect and contact us? You got Dr. Avi Charlton, Low Carb Lifestyle GP. You can take a screenshot of this. So I leave this on for a little while. She's very active on Facebook. Every day you will see her post, and she talks live on Facebook too. So you can go in there and listen to her. She also offers 15-minute free chat that you can book in to have a chat with her. Her website is amazing, and she's sought after speaker, and she's interviewed by many people on various platforms and podcasts because as you know, GPs, lifestyle GPs are rare and they're precious gem. For me, I started life as a dentist. I now am a health and wellness consultant. I have a Facebook page, and that's where it is. I have a website, and also I have a website with the supplements. So a disclosure here, if you see any affiliate links in any of our website, and if you do purchase a product, we may earn a commission, but it's at no extra cost to you. So this is full disclosure. This will help us to continue to give you educational talks like this to contribute to the community using our personal time and our personal resources. So I appreciate your support, and so that we can continue to support others who may need our services and care. I have to always announce our next event. I host Health and Wellness Conversations series. My next one is with Dr. Lana Galicia, who is a pain management specialist and anesthesiologist, and she's from the US, and that will be on Thursday, 29th of August, 10 a.m. Sydney, Melbourne time for Australia. It will be 5 p.m. In US in LA time, PST. So thank you. That's Dr. Avi and Dr. Caroline Hong here. Disclaimer, opinions expressed here are all personal opinions and are not to replace the advice from your healthcare provider. But Dr. Avi is a GP, so you can ask her. So I'm going to stop share screen, and we're going to open up, and we can open up to questions, okay?
Yeah, what amazing journey you've had, Caroline. You've burnt out and then you've recovered and you look amazing.
Thank you, thank you, thank you.
My question is that I myself have been through a lot of challenges in my health as well. So early this year in January that I was put on a protein and vegetables diet. So basically, like what you say, it's just 2 tablespoons of carbs. When I was so excited, I lose the weight that I didn't get to lose for the last 10 years. But I shared it with my friend, she told me, she's from Singapore, and she said that she has early signs of kidney problems, and where there were bubbles in her urine. And she said that her doctor told her not to take supplements. And I didn't dare to advise her what else can she take, because my diet that I was put on, right, is high protein. I also know that for someone who has a kidney problem, right, high protein is quite dangerous for them as well. Put aside the supplements.
Okay.
So
What's your take on that?
I'll comment on the protein. It's actually quite a common thing the doctor says to a patient about protein is dangerous for the kidneys. In fact, it depends on what the cause of the kidney disease is. Quite often, the most common cause of the kidney disease is diabetes and hypertension. And improving those two diseases can actually improve the kidney disease. So I can't comment on your friend. I don't know what the cause of the kidney disease is, but reducing carbohydrates can certainly help with hypertension, because hypertension is part of metabolic syndrome. And you will find I actually do find that if I reduce the carbs for a patient, and their blood pressures get better, especially those who eat lots of processed foods and sugars. And then if I control their blood pressure, if I control their diabetes with low carb, quite often their kidney function actually gets better. I actually see the kidney marker called eGFR improves when they go on a low carb diet. So yeah, that's my take on protein. Usually not too dangerous.
Thank you.
what about taking supplements? Because she refused to take a supplement because the doctor says so. And I didn't want to, and I'm not a doctor, so I don't know if I can ask her to supplements with the supplements to help her in her health.
May I answer that question? Betty, when you say the doctor asked her to not take supplements or to take supplements?
Not to take supplements. Because
Yeah.
I tried to ask her, say, you take the Purify, it will help to detox your body, and it will help you. And but my doctor said no supplements.
Yeah. The best way is to ask the doctor to look up on their computer screen, type in pdr.net and type in THREE, just as way of example, because that's the only company that has all the supplements listed on the PDR. And then the doctor can see all the ingredients in there, and then the doctor will be in a better position than to blanketly say no. Because the reason why most doctors, and I'm sure Dr. Avi would agree, say no to supplements, because for a long time, supplements have bad name. They don't absorb. They have a lot of synthetics. They have a lot of fillers. And therefore, and also they're not often what they say on the label, because they're not quality control or third-party tested. They're mostly not listed on the PDR. Only 22 companies, only 22 nutraceutical companies in the whole world are listed on the PDR, and our company is the only one that has all 6 products. There are other companies, other supplements that are good too, but our company is the only one that has all 6 listed. So the doctor can look at the others as well, the other 22 companies, as well as ours, and decide, because most doctors only have one lecture, if at all. Dr. Avi already mentioned, right? You don't have many lectures on nutrition, do you? Nutrition,
No,
the supplements
not at all.
are nutrition. They're dietary nutrition, the dietary supplements. So ours is whole food. So it's like, if you can eat food, you can eat the supplements. And as long as they're not synthetics, and as long as they absorb, as long as they actually contribute to human health. Yeah. I had one lecture on nutrition, but as a dentist, I have to talk nutrition and diet to my patients, but it's always about sugar, and not very much else. Just don't take all these, don't take sugar. If you do, take it all in one lump sum. But that's bad. That's actually bad. Dr. Avi, do you know that all dentists, they tell the patient, if you have a craving for chocolate or sugar, take it all in one go. And you just highlighted not more than 1 teaspoon of sugar.
Yeah.
So that's bad. What we've been telling patients is all bad. It's all wrong.
Yeah.
Yeah.
I did share with my friend about the PDR thing and asked him to bring the website to her GP. And her GP should say, be careful.
Is there a camera?
Go to another GP and ask us second opinion. Yeah.
Okay, thank
But
you.
we shouldn't in this session, we shouldn't be making those sort of advice anyway. Right, Dr. Avi? We
Yeah, we can't really give personalized advice. It's up to that individual.
yeah.
May I ask a question?
Who is
please?
that? May I know who is this?
It's Peter, and I'm in Port Macquarie.
Oh, Peter. Oh, hi, Peter. How are you?
Good, thank you, Dr. Caroline. I'm in my late 70s,
Yes.
and my wife and I, my wife's younger, and we're trying to lose weight, and it's very hard for us to stick to anything. Is there any possible diets that we could perhaps get on? Now, I'm type 2, and I, thank goodness, like yourself, Dr. Caroline, I'm controlling that, well, still controlling it by diet and exercise, no medication. But is there one that we can get on to lose weight? Because both of us are overweight and need to shed some kilos. Is there anything?
I would really suggest a low carb diet. What happens is the low carb diet will help you lose weight. It'll control your diabetes. It'll improve your health. It'll control any hunger. You feel more full. You feel you have reduced chance of other chronic diseases like cancer, Alzheimer's, or a lot of other chronic conditions as well. So it'll improve your health as well as help you lose weight. It is hard because the whole society is ingrained with lots of carbs, cereal, the chips, bread. It is hard, but if you change your mindset, real food, meat and veggies, the bread and the cereal are actually not real food. So it takes a bit of mindset.
Yeah.
Yes, you just mentioned most of my favourite foods there just then, Dr. Avi.
Yeah. Well, again, it's a mindset change because
slowly. You don't.
if you know they're not good for you, maybe it won't be your favorite. Maybe you can have a different favorite, like a steak. Most men would like steak. Yeah, maybe that could be a new favorite.
Yeah.
All right, then. And
I think
thank you both.
obesity and weight management is a big problem in Australia, which is
Yes, it is. Yeah.
Rising diagnosis of diabetes, particularly diabetes type 2, and there's at least 500,000 people are probably not diagnosed with the disease either. But Peter, in addition to what Dr. Avi talked about low carb diet, I believe it works because I am on a low carb diet, and I've been able to maintain my weight, and I can wear all my outfits, and that's my other motivation. No need to buy new clothes. And and also because during the pandemic, all the Zoom sessions, you're sitting down most of the time, and you're sitting down more than ever. But I do a active exercise program for myself of all kinds to make it interesting. In addition to what Dr. Avi say, the supplements that I mentioned, which is in another talk, one of the products, Purify, which is a daily detox, will help with the weight management, because by detoxing, it also help with getting rid of all the toxins, and with your metabolic helps with your metabolic health as well. So using the supplements that we have, not only fill in the gaps of all your nutrient deficiency and cravings, but first of all, do what Dr. Avi said, get all your nutrients from food, not processed food, from fresh food, meat, vegetables, We are very lucky in Australia. We have easy access to quality food. Think of other countries that don't have that. So start small steps. Don't aim for elimination straight away. I think that would be hard, wouldn't it, Dr. Avi? Maybe
Yes,
for like
can be quite
50%,
difficult.
50% first. Maybe you can
Yeah,
have a call with Dr. Avi. She does telehealth as well. Yeah.
yeah. We can work on ways to slowly have a plan. Some people just find if they don't eat sugar and processed food first, that can be a good step. And just keep the bread and potato for now, and then just have it sitting at the back of the mind
Yeah.
that they are not so good as well.
Thank you. Thank you. Amy, do you have a question, Amy, in Perth?
It's Wendy.
Oh,
I've got a question. How do you define low carb? Is in the sense that, okay, particularly Asians, we love our rice. I'm not too much into potatoes, and but I do like the rice and
My noodles.
bread, but not every day. So how much do you define like low carb? How much
Yeah, sure.
like how many days can you eat rice? Or I mean, I can't say that I eat a big amount.
Okay, I can. I'm happy to start. So, ketogenic diet is very low carb, less than 20 gram a day. Low carb is less than 50 gram a day. So you can get some rice and measure 50 gram of carbs. But you have to understand the rice that we have nowadays is much more refined than the rice that 100 years ago our grandparents ate. So we have much less fiber in the rice we have now. Back in those days, the rice is much more got roughage and fiber in it. So there's much more sugar in our rice than 100 or 200 years ago. The problem is it's paired with a lot of other processed foods that gives the rice a problem. So yeah, so I can't answer you how many days in a week you can eat rice. I would just try and cut down as much as you can tolerate.
Tolerate is the word.
Sure. Thank you. I think that
gradually, Wendy. Yeah, because I part of my problem in the past was I would eat a whole plate full of rice in the evening.
Yeah.
I have reduced in amount per day,
Yeah.
but not necessarily. I don't have it every day either.
Sure, yeah.
But yeah, I have reduced the amount. And the one that I'm currently buying actually says low GI.
The thing is,
Not sure whether it helps or not.
Yeah, the thing is understanding it does become sugar. Maybe it helps you just understanding that it is not so good and it does
What
raise
about
the
brown
blood glucose.
rice?
Yeah, brown rice is giving you sugar slowly. White rice is giving you sugar quickly. So it's still sugar going in the same way.
Yeah.
Okay, thank you.
Thank you. That's a good
talk.
Can I ask a quick question? What about basmati rice?
Oh, yes, Betty.
Basmati rice is the same story as the brown rice.
And jasmine rice, they are all in the same category.
Well, jasmine rice is more the white rice than the brown rice. They
Say
are
it
all
again.
more white rice than brown rice, so they're quick sugar.
Okay, jasmine, then basmati, then brown rice.
They're all sugar, just so you know.
Okay. Yeah, I'm just trying to understand that which one has less in that sense. I know it's sugar, but which one is the best out, not the best?
Which one is the best out of the bad?
Maybe basmati or brown rice, I would say. Yeah.
Because it's got fiber as well.
Yeah.
What about noodles? My challenge
Noodles is they're refined carbohydrates.
Refined carbohydrate.
Yeah, they're not that good.
Rice. Okay.
That's why Asian people suffer. There's high incidence amongst Asian people.
Yeah.
It's type 2.
Yeah, just remember we don't show the fat on the outside.
Yes, yes.
A lot of
Look
skinny,
into, you
skinny.
don't look at, right?
We
It's
don't look at. My mum had diabetes, and she's just as skinny as I am.
Is that the reason why in India, even though the poverty is very high, but yet a very high records of diabetes because they cannot afford to eat meat, so the only thing they can feed their hunger is
Yes,
rice.
it's a bit complicated in India because they don't want meat. They are vegetarian. They're educated to not, they don't want meat. But then there's other things like they've been through a lot of trauma and starvation in a generation or two ago with the British. So that actually changed their epigenetics that Caroline was talking about. They have a lot of diabetes and obesity because of the stress they've gone through,
Okay.
as well as the diet, as well as the rice and the roti bread.
yeah.
Okay. It used to be, they say type 2 diabetes is a rich man's disease. And I was thinking, but then why is in India?
Yeah, it's a poor man's disease as well, eh?
Mm.
So I think we
Thank you.
will wrap up so that Dr. Avi can go back to her young family. Thank you everybody for showing up, and reach out to us when we have further events. Some Dr. Avi also have podcasts and live Facebook. So follow her on her Facebook. Very interesting. Follow me as well. So thank you again, and good night to everybody, and stay well, everyone. And at least give it a go, low carb diet, and also give it a go with your nutrition supplements, but make sure that they are the quality, high absorption ones, which can actually give you healthy epigenetics. All right, on that note, thank you and God bless everyone. Thank you very much for being the best part of today. Without the audience, this would not go on.
Thank you so much, Dr. Avi and Dr. Caroline. It's a fantastic session.